Okay, so I'm going to start with hand hygiene. I'm going to introduce myself to the patient. Hello, my name's Davey. I'm going to be your nurse today. I'm going to have them verify their name and date of birth, and I'm also going to check their wrist tag. I'm going to provide privacy to the patient, and I'm also going to explain the procedure. So today we're putting in a catheter so you don't have to get up to use the restroom. I am going to be on the patient's right side because I'm right-handed, and I'm also going to raise the bed to working height. Alrighty. I'm going to invert the patient, and I'm going to have them in the dorsal recumbent position. You can help me. I'm going to grab my supplies. Let me throw this away. Alrighty. I'm going to make sure to open it away from me. I'm going to take my gloves. And make sure I take off all my jewelry. Okay, gloves are on. And I'm going to drape my client. Next, I'm going to rearrange my supplies. And I'm going to get them set up. I did touch the trash can, so I did break sterile field because I didn't need to touch the trash can, but I did. So I would restart. Alrighty. And I'm going to take the open up the labia. Gonna go one swipe on the side. One swipe on the other side. and one down the middle. Don't re-swipe on it. I'm going to take my catheter tip, hold it 3 inches away from the tip. I'm going to have my assistant help lubricate it. And then I'm going to tell my patient what to expect. So it might be uncomfortable, but it shouldn't be painful. If it ever gets painful, let me know. I'm also going to tell my patient to bear down, and I'm going to insert the catheter, going 2 to 3 inches in. Then I'm going to fill the balloon in the catheter. Okay. Then I'm going to tug to make sure it's the base of the bladder, and then insert a little bit further, secure it in there. I'm going to let go of my hand. I'm going to tear this and dispose. I'm going to grab my stat lock. Okay, well, if this would happen in a normal situation, I would get a new one because it just folded on itself. And I would secure it on the patient's inner thigh and secure that set lock. I would also clean the skin before putting on the stat lock. Okay. I'm gonna take the bag and I'm going to attach it to the side of the bed. I'm also going to assess for urine flow and making sure that there's no kinks in the bag and any obstructions. I'm going to take my equipment and dispose, as well as taking off my gloves. I'm going to do hand hygiene. Then I'm going to put my patient back into a comfortable position. I'm going to redrape them. I'm going to lower their bed to a safe height, making sure the guardrails are up. I threw everything away, did hand hygiene. Now I'm going to document the procedure. So I'm going to date and time it. I'm going to record the character of the urine, the reason why we needed to insert the catheter, and then patient tolerance, and I'm done.